So like Mary Bell said, my name is Talia Thompson, and I'm from the University of Colorado. Today I'm going to be presenting on a multi-phase collaboration that I've been working on with Mary Bell for a few years and a lot of other people, and we're calling it the Turner Syndrome Anxiety Project. So I just wanted to start off by saying that I'm the one presenting today, but this work came from the hands of many. This is a collaborative project. These are the current core members of the research team, but there's many others that you'll see throughout the slides and many more coming. So I want to invite everyone here to be a part of this research. If this is something you feel passionately about and want to be involved in, whether as a research participant or on our research team, potentially as a co-investigator or on our community advisory board, please let us know. I'll have my email address and our study team email address at the end, but we want to invite people to be a part of this research with us. And then I will also point out that Alexa Carl and Natalia Klamut, who are our amazing project manager and coordinator who really make this study happen, are here today as well. And so they're going to be sharing some things in the links or in the chat, some links in the chat so that you can see where to find some of the products that we've been disseminating from this research. So here's our agenda for the night, or for the day. I'm going to answer these 5 questions, or try to. We're going to talk about what is anxiety, why do we study it in Turner syndrome, what is this type of research we do, which is called community-based research, what have we been learning through our study thus far, importantly, how could this possibly benefit the Turner syndrome community, what are we going to do to make that happen, and then what's next for our project. And we're going to start off with a little activity. I'm a psychologist, and often in my therapy, I use play therapy to try to practice and learn new skills. And so I've played a lot of this game in my therapy when I worked in the schools. I'm curious if people know what Jenga is, if you can, I don't know if you can use a symbol to show me that you've heard of this game, or you can even throw in the chat. I see some thumbs up there. Okay, so some of you know what Jenga is. So for those of you who might not, it's a tabletop game. You construct a tower of blocks very carefully, and then the game begins by removing the blocks. So each player takes turns carefully removing a block one at a time. And the goal when you play Jenga is to remove a block without causing the tower to fall down, right? So as you progress through this game, the tower becomes really more and more precarious and less stable. The outcome becomes very unpredictable. You really don't know what's going to happen or when it's going to crash and when it's going to tumble down. And so as you can imagine, this game can actually be quite useful for teaching and learning about what anxiety is or what stress is. So we're gonna put ourselves in this place. We can't play Jenga together today, but I want you to imagine that you're actually playing Jenga. I'm going to ask you to do a little participation. So I want you to put yourself in this position. You're actually playing with these people at this table, and this person who's pushing the block out right now has gone in front of you, and clearly this tower is very unstable at this point. And it's your turn. You're next. And so I want you to imagine that you're reaching toward the tower and you accidentally kind of bump the table and it's wiggling a little bit, and there's lots of giggling and excitement in the room, if you can imagine what that feels like in this moment as you reach for this block. So I'm going to ask you to start to turn your attention inward and start to pay attention. How do you feel? And I'd love for you to throw in the chat, what feelings are you having? What emotions come up as you reach for this block on this unstable tower? How does your body feel? What sensations are happening in your body? What's happening to your muscles or your tummy or your heart rate? What are you feeling? So please put it in the chat and help us understand. What does it feel like when you're about to take out this block? See stress, tension for sure. Sometimes we'll hear people describe nerves or a feeling of butterflies in their stomach. Some people's heart rates start to increase. Some people make sort of a different face, a very tense face. Some people just love it and are having fun, enjoying the game and the stress of the game. I love what I just saw this in the chat. Anxiety and mad because I'm about to lose. So what I was going to ask for you to do next is to ask yourself, what messages do you tell yourself as you're about to grab the block? What might you tell yourself? So what are you thinking about? And throw that in the chat too. So sometimes we're thinking it's going to fall, or we're thinking, I hate this, or I'm about to lose this sucks. I don't like this. Don't screw it up. My hand is so unsteady, right? Oh, it's going to be so loud, right? Or maybe you're having a really positive thought like, oh, this is all just for fun, or I can handle it, or at least the game will be over soon, right? So thank you for participating. I like that. I might get lucky and win, right? There's lots of different thoughts, lots of different feelings. But the reason I wanted to do that activity with you today is to just ground ourselves in what we're talking about, and to understand that anxiety is both a physiological experience, as well as a cognitive experience. It involves our thoughts, and it involves our body. It involves what we think and do. It can be defined as the persistent and excessive stress and worries that don't go away even in the absence of a stressor. So it's different from fear, even though we use those words interchangeably sometimes. Fear is an appropriate response to a clearly identifiable threat. Even a minor stressor like the game is gonna, I'm gonna lose the game maybe because the tower might fall down. That's an immediate threat. But anxiety is when these worries and feelings and stress in our body continue even when the stressors are not immediately present. Anxiety is forward focused. It's like an anticipatory worry. Sometimes we worry about things that have happened in the past, but usually that's about how those things in the past are going to impact the future. And there are several conditions under this sort of umbrella that are all known as anxiety disorders. So there's a generalized anxiety disorder that is more persistent worry, social anxiety disorder, which is not just shyness or introversion. It's really an intense fear of being judged. Separation anxiety, that once we're past a certain age and we're expected to be more independent and expected to be away from our parents, this is like the excessive concern with that, being away from an attachment figure. Panic attacks or panic disorder are these abrupt surges of intense fear or terror. And they're frequent, they're unexpected. And then phobia is a more focused, intense fear about something specific, a specific event, a situation, maybe flying on an airplane, maybe intense fear of an object like a needle, or a situation like a medical appointment might be part of a phobia. What's important to know is that anxiety actually can be protective, right? So this is our body has a natural physiologic response to an acute stressor. Our sympathetic nervous system gets engaged and it prepares our bodies. So those things we were feeling like tense muscles, and those muscles are ready to fight, right? Or they're ready to run. Our breathing increases. We're getting more oxygen to our body so that it's ready to face a challenge. And actually, there are some benefits to mild levels of stress or mild levels of anxiety. It can help us stay safe in the face of danger. It can help us perform better. But the problem happens when there's persistent anxiety, there's no immediate stressor, and then that can really start to cause some major health problems. So we can have insomnia, difficulty concentrating, serious fatigue, Muscle tension over time can cause a lot of pain and irritability. And then also we tend to avoid things. When we're chronically anxious, we avoid things that cause the anxiety. It makes sense, it's a self-protection, but then that can lead to this reduced opportunities, a reduced participation in the world. And that, of course, can impact our education, our employment opportunities, and then it really can interfere with our ability to connect with other people. It's also really important to know anxiety is common. So there are probably people on this call right now who do not have Turner syndrome, but do have anxiety. That is common. So it's not something unique to Turner syndrome. It's the most common group of psychiatric disorders in children and adolescents, actually. And studies show anywhere from 10 to 30% of all children will experience anxiety at some point in childhood and adolescence. And it can be much higher in different demographic groups who have higher risks. And certainly increased and has remained high after the pandemic. And what's interesting about anxiety is you can see in these bar charts here, it's more common than depression. It starts as early as preschool. We see it really early, and it tends to increase with age, so becomes more common as kids get older. Whereas with behavioral disorders, we see a spike maybe during the school years, and then in adolescence and adulthood, we see fewer behavior problems. Anxiety actually continues to increase in likelihood throughout adolescence. And we know children and teens who have anxiety younger in life are actually much more likely to have another episode of anxiety disorder in adulthood, and to also experience some comorbid conditions like depression, substance abuse, and then have poorer school outcomes and work outcomes. So it's an important thing to study and understand because it has a big impact on quality of life. One of the best things and why I love studying anxiety is that we actually know there's a lot of research that shows that anxiety disorders are treatable. And I think that's really important to know going into this work, is that there's a lot of evidence out there to support multiple different types of therapies and interventions, treatments for anxiety. I will say there have not been any of these tested in Turner syndrome. And we'll get to that because that's a goal. But in the general population, some of the ones that have the most evidence behind them are cognitive behavioral therapy and SSRI or other daily anxiety medications, especially when coupled together. But there are a lot of other different interventions that have been known to work, that I use frequently in other patient populations, and that have shown to have efficacy and effectiveness. So why did we want to study it in Turner syndrome if we do know a lot about anxiety in the general population? Well, mostly because it's a community priority. So we know Sandberg et al. Did a survey of people with Turner syndrome and caregivers, and they found that the vast majority, 90% of people who were surveyed said that emotional health in Turner syndrome is a very important topic to research. We also know through the InsighTS registry that anxiety receives a high rank score. We ask people to rank on a scale of like 0 to 100. How important is it to you that we research this topic? And anxiety receives one of the highest ranked scores. And most of all, the community asked us to do research on anxiety and Turner syndrome. Mary Bell Good and others from the Turner syndrome Colorado group approached us and actually asked, we need to partner on this. We don't understand what's going on. The community is asking for help. Let's work together. The limited research that is out there on anxiety and Turner syndrome is very interesting, but it is very limited. So of all the research done in Turner syndrome, only 9% is actually focused on psychological or behavioral health. 91% is focused on biomedical research. And that is really important. I work with these biomedical researchers, and their work is so critical to keeping kids with Turner syndrome healthy and happy and alive. It's very, very important research. So, but it's obvious that we need more balance because the community is telling us they want us to understand and help with things like anxiety. And there's very, very little research being done at this point. The research that does exist, though, is interesting. It shows an increased risk for anxiety and depression over the life course for people with Turner syndrome. So they have a higher risk of developing anxiety. They also have an increased risk for some of those stress-related physiology, what we were talking about, and feeling in our bodies with that Jenga game. Things like increased heart rate, high blood pressure are also common in Turner syndrome and are also associated with anxiety. And then there have been brain imaging studies done that show alterations in the structure of the brain that are also associated with increased anxiety. So differences in the amygdala and the prefrontal cortex that we also see different in people who have anxiety who don't have Turner syndrome. Some of our own research has been interesting. So despite that, these known increased risks for anxiety in Turner syndrome, we've actually found that children with Turner syndrome are less likely than children without Turner syndrome to receive a diagnosis of anxiety or to get treatment for anxiety. And this doesn't really make sense. We don't actually think this means that kids with Turner syndrome are less likely to have anxiety or don't have the anxiety. We hear from families that they do. We think somehow we're missing it. We're missing it in clinic. And the research really is not clear on why we're not picking up these diagnoses of anxiety. And really what we've come to realize is that traditional research methods, the traditional scientific research method where we scientists come up with a question, we develop a study design, we analyze a bunch of data, these methods aren't actually helping families and kids with Turner syndrome in regards to their anxiety. They help a lot in the biomedical field, but with mental health, we need a different way in. We needed to try something different. We really want to understand how people with Turner syndrome experience their anxiety, how they're managing their anxiety, and then what are some of the barriers to care so that we can try to improve rates of diagnosis and improve treatment so more people are getting help who need it. So that's why we did this community-based participatory research. So this is a collaborative approach to research. It's different from a lot of the research that you'll hear in some of these other sessions. It's a different way in. So the big points that we want to make are that it's equitable. So the community partners and the academic partners are equal in the research. We are addressing a topic that's important to the community. And our goal is not just to build knowledge and write papers. Our goal is to make action for social change. So we have to disseminate our findings and we have to try to improve quality of life with our findings. So the goals of this study are a little bit different from other scientific research. So here's what we did. Briefly, this is our study design. It sort of shows we used a mixed methods sequential explanatory design. And what that means is that we met with a community advisory board. We met with them quarterly, and that board was made up of 3 patients with Turner syndrome, 4 parents, and 3 clinicians, and then our research team as well. And so first, the advisory board helped us design and develop a survey that people could understand, that made sense, and that helped us understand anxiety symptoms and triggers in the community. And then we took the results from the survey and worked together with the advisory board to try to make sense of the data. What does this mean? And what questions remain? And so then the team helped us, and we all worked together to develop an interview guide. And we went out and did in-depth interviews with 5 people with Turner syndrome and 5 parents of people with Turner syndrome. And then we brought those data back again to our advisory board and said, okay, here's what they said. What does this mean? What should we do with this next? So that gives you kind of an idea of how we went through our data collection process. Our analyses were really rigorous. We used a whole host of statistical analyses. We used a rapid team-based approach to our qualitative thematic or our qualitative analysis. So these results are based on rigorous science and will be publishable as well, in addition to being really useful. So here's what we found. We surveyed 135 people, 74 were people living with Turner syndrome and 61 were the parents of people with Turner syndrome. And just to note, the group of self-advocates is what we're calling the people with Turner syndrome. This was an older group. So the caregivers were talking about children who were younger, and the people responding tended to be teens and young adults with Turner syndrome. So that was one of the major differences between the 2 groups. The majority of the people who responded also carried some anxiety diagnosis. We wanted to know how frequently people with Turner syndrome experience anxious symptoms. The majority of our participants reported that they received them 2 or that they experienced anxiety 2 or more days a week. 2 or more days a week is indicated by orange. And you can see as the color gets darker, that actually means more frequently. And so almost half of our participants are actually experiencing anxiety more than half of the week. Parents actually reported a lower frequency of anxiety than our self-advocates did. And this might be because like anxiety is an internal experience. Like when we were reaching for that Jenga block, we didn't have to let anyone know we were anxious. So it may be that parents don't always actually know when their child is anxious. But it could also be because our self-advocate group is older, and we know that anxiety symptoms do happen more commonly in older adolescents and adulthood. We also asked participants to rate the impact of the anxiety on their daily life. So we use this scale of 0 being no impact at all the way up to a 10 saying it's a serious impact on my life, so much so that it gets in the way with my participation. And both respondent groups reported that anxiety regularly impacts their life. The average hovered just around this 5 mark, that it's impactful, but they can still participate. But you can see these lines represent the range of scores that people put. And so it just illustrates how very limiting anxiety can be for some of our Turner syndrome community. We asked where anxiety was likely to occur. So our self-advocates reported that their anxiety was mostly triggered outside the home, mostly at school and work. But then they reported that they expressed their anxious behaviors mostly when they got home. And parents reported the same thing. So people at school and work might not even recognize or see the anxiety because it's an internal experience. And then this, of course, places a huge burden of supporting anxiety management on families, on parents who are doing a lot of adaptations in the home to try to accommodate for anxiety. We heard a lot of behavioral symptoms for anxiety, and then also those physical symptoms that we tried to feel while we pretended to play a game. The top 5 most frequently reported behavioral and physical symptoms overlap a lot between patients and or between self-advocates and caregivers, but there's a couple differences. So caregivers report their child seems anxious when they're clinging to them. The people with Turner syndrome reported that they have more negative thoughts, which is an experience that others might not know about. So it's something that parents might not report as often. But overall, what is important to know is that the signs of anxiety in Turner syndrome appear to be really similar to the signs of anxiety in the general population. So things like rumination, worrying a lot, avoidance of something that might trigger the anxiety, and then rapid heart rate or increased heart rate, rapid breathing, muscle tension. One really important finding is that insomnia was the most commonly reported symptom of anxiety across all age groups and both reporter groups. And this is definitely something we want to follow up on, is working on understanding the mechanisms of insomnia in Turner syndrome and how we can potentially improve sleep. There were some linear relationships with age. So there was a decreasing odds of physical aggression, tantrums, and clinging. So as people were older, they did less of those behaviors when they were anxious. That makes sense. Those are behaviors associated with younger children. Although we did still see and hear a lot of clinging behavior in adolescence. So kids with Turner syndrome who are in their adolescent years, when you would expect them to be leaving their parents' side, were still clinging. And then we saw an increasing odds of GI problems. We asked participants about what triggers the anxiety. So what causes it? What happens that makes you feel so anxious? So across our older participants, these are teens and adults, we heard that like dealing with conflicts and recalling an event from the past could trigger anxiety. But the kids looked a little different. So very young children were, their anxiety might be triggered by a noisy or stimulating environment or having to make a transition throughout their day. And then both kids and younger preschoolers reported and talked about how doctor's appointments and health concerns were triggers for anxiety. Again, we found some triggers tended to increase as people got older. They were anxious more often because they were dealing with conflict or managing an expectation or recalling something negative in the past. But then we also saw these interesting relationships that were not linear. They were like these spikes in different age groups. So for school age kids, organization was a frequent trigger, where organization wasn't as much of a trigger for older respondents. And then for adolescents, friendships were an incredibly common trigger for anxious feelings. Respondents told us lots of ways that they mitigate their symptoms of anxiety. And this was such a wonderful thing and hopeful part of our study, as we heard a lot of ways that people are responding to their anxiety that seem to be successful. And it gives us hope for future research too. Overall, this shows just, this figure shows therapy and daily medication. And so in each cluster of bars shows different age groups. So you can see the black bar means something they've never tried. They've never tried therapy. They've never tried medication. The red bar means I tried it and it wasn't helpful. And the green bar means I tried it and it was helpful. So you can see pretty much overall, we found therapy and medication for anxiety increased with age. More people try it as they get older. And the majority of people who tried medication and or therapy found them to be helpful. Not everyone, this is still interesting. People who are trying therapy, some people say they're not helpful, so maybe we need to tweak the therapy, but it's encouraging to see that there are solutions, things are working for some people. We also did these interviews. So some of you may have participated in this study, and if so, thank you. And some of you may have done the in-depth interviews. These were very in-depth interviews with parents and with teens and young adults with Turner syndrome. And we had a lot of rich details describing what it's like to be a person with Turner syndrome and having anxiety. So we heard these kind of three themes. So first, we heard Turner syndrome related features are often the triggers for the anxiety. So like having a learning disability or having social skill deficits or having to have frequent medical procedures or just being different from peers and from family could trigger anxiety. We also heard a lot of stories about how anxiety impacts the entire family system. It's an especially large burden on mothers who are often managing Turner syndrome related care, in addition to managing household obligations, and are working really hard to accommodate the anxiety in the home setting. And then participants also described opportunities that to identify and treat anxiety earlier in life. So people described missing early symptoms. I didn't recognize what it was when she was younger. I didn't see that it was anxiety. Now it's so clear, but it doesn't become clear until it's really far gone and the child is really suffering. Or providers who just really weren't focused on the fact that kids with Turner syndrome are experiencing anxiety and it might be something that needs to be addressed. They're more focused on the physical health issues, which makes sense, especially based on what we know about the research. There's not a lot of research on it. But providers who might be unaware that there's this connection. And those who had early treatment showed a real great appreciation and just talked about the benefits in their lives of having had early conversations with their doctors about their anxiety and really receiving early treatment. So what does this all mean? Mostly, here are some of the big takeaways. Anxiety symptomology in Turner syndrome, so what anxiety looks like in Turner syndrome, aligns with just the diagnostic criteria for anxiety. It looks similar to what you would see in a lot of people with anxiety disorders. However, the triggers, what tends to cause the anxiety, seem to be aligned with a lot of what we know happens when someone has Turner syndrome. And so that may increase the vulnerability of people with Turner syndrome to be more predisposed to experience anxiety. We also know it looks different with age across the lifespan. So we're not just looking for one behavior that's a telltale sign of anxiety for people with Turner syndrome. The symptoms and also the triggers, things that cause the anxiety, are going to change over time. So it's going to take a nuanced approach to identifying different behaviors and how they might be anxiety at different ages. And we also heard loud and clear that families carry a heavy burden of anxiety every day. And so any intervention we design is going to have to involve the whole family system. We really can't just target people with Turner syndrome. It's really something that needs to address family needs as well. Like I said at the beginning, dissemination is crucial for this type of community-based work. We can't just stop and say, yeah, that's what we learned. We wrote a paper about it. We actually have to benefit the community. That's our work. So our work isn't done. So we've been trying to speak. We've spoken at family conferences. We've made a video and some handouts that I'll share with you in a second. We also have a couple web pages. So we have this Turner Syndrome Anxiety Project webpage with family resources through the Turner Syndrome Colorado. So I think Natalia is going to throw a link in the chat for people. If you can click on it and you could bookmark that page, it has a lot of resources for family that are evidence-based. They're resources from really well-established agencies that have great ideas for how, if you are experiencing anxiety or your child is, things you can do. We also have a new academic website that Alexa Carl put together that has all of our academic products, so manuscripts and abstracts. So if you want to read an academic manuscript, if you want to share it with a physician or a provider, please download these, share them with your people, read the research, and keep track of what we're doing because we update it regularly. We just had an abstract accepted this week and a manuscript accepted today. So they're on there, check them out. So we're trying to reach the clinical and research audience as well as families. So one of our resources for families we have is this YouTube video. It is 8 minutes long, which I think is like epic now. I think now you're supposed to keep everything under 2 minutes, but it's a really rich and interesting video. I highly encourage you. We're going to have the link for that also thrown into the chat. This is our 10 things we learned about anxiety and Turner syndrome. We worked really hard with our advisory board to make sure the language was understandable, accessible. You can send this to grandma, you can send this to teachers, you can send this to anyone you want to understand what anxiety and Turner syndrome might be like. It's narrated by our wonderful patient advocate, Mary Rose Masters, who has worked really closely with us on this team and has had a lot of input into the visual presentation, the wording to make it really accessible. So check out our YouTube video and let us know what you think about it and share it widely. We also made a series of one-pagers, we're calling them. These are one-page handouts to increase awareness about anxiety, but they're made in a really approachable, family-friendly way. So there's 3 of them. One is for individuals with Turner syndrome. It says, do you have Turner syndrome? You may be experiencing anxiety. And it has some quotes so that people can hear they're not alone. We're hearing similar things from lots of people. You might have some shared experiences. And then it has some tips. What do you do? What are some things you can do to manage your own anxiety? The one for parents is, do you have a child with Turner syndrome? They might be experiencing anxiety. Here's what we've heard from other families. Again, you're not alone in this. And then some suggestions for how to manage anxiety in the home setting. And then we also made one for teachers. So we heard from a lot of people that school is triggering their anxiety. So we wanted teachers to know, hey, do you have a student with Turner syndrome? Here's what they might be experiencing. And we actually have a list of classroom accommodations specifically tailored to Turner syndrome and anxiety that you could share with a teacher. So for all 3 of those, just so you know, the first page or like the first side, the front side is the same. So if you open the documents, you might think, oh, they all look the same. The front page is the 10 things about anxiety that we learned through our research. So it shares the front page, and then the back side, or if it's a PDF online, you scroll down, that's the targeted one for these audiences. So you can scan them, the chat, it's in the chat, the links are in the chat now, and we would love for you to download these. They're free. We want you to share them widely with anyone who you think should know more about Turner syndrome and know more about anxiety and Turner syndrome. So we're not done. We finished that project and the funding for that project ended, and we realized we just scratched the surface of what we can do to help the community. And so we received funding for another grant here, a grant-funded project called the RATE study. And this is recognizing anxiety and Turner syndrome early. So here, the goal of this project is to develop a better screening process for anxiety in Turner syndrome clinics so that kids don't go years undiagnosed and they can get treatment when they need it right away. So we just completed AIM-1, where we actually partnered with our advisory board again. They came back, we added some new people, and we interviewed a bunch of parents and kids with Turner syndrome to adapt a screening tool for the Turner syndrome community. And now we're in AIMS 2 and 3. AIM-2, we're trying to test the validity and the reliability of that screener, make sure it's scientifically sound, that we could use it in clinical trials or in a clinical setting with confidence. And then aim 3 is testing to see, like, is it actually useful? Is it feasible in a clinic setting? Like, would people actually use this thing that we've made? So we're administering it to all of the patients who come through the Turner Syndrome Clinic at Children's Hospital, Colorado. Those 2 are ongoing. You can actually participate in RATE aim 2 if you meet the inclusion criteria. We're currently recruiting from InsighTS. So if you're in the InsighTS registry or your child is in InsighTS, you can participate. We pay for participation, which is really exciting. And this study does not involve coming into a clinic. You don't have to provide any specimens or anything like that. It's just filling out some electronic surveys. So it's a pretty low burden, but the return will be huge. So we would love for you to participate or let others know that they can participate as well. Again, we've got the links in the chat and you can scan here. If you don't know if you're in InsighTS, you can email and find out if you are. This is very exciting. Where are we headed next? We really want to develop an intervention. That's pretty clear that we need to intervene and we need to intervene early. That's what this study's shown us. So we know an intervention would be an important way to improve outcomes in Turner syndrome. So we're planning to start with a cognitive behavioral therapy program. That's really the gold standard in anxiety treatment for kids and adolescents. But we need to adapt it to the Turner syndrome community, make sure it's like relevant, that it's doable, that kids can access it and learn from it. But as a preview, this little figure here over on the side shows you this kind of therapy basically teaches kids how their thoughts and their feelings and their actions are all connected. And well, it's really hard to just like change your feelings and feel happy or stop feeling anxious. That's almost impossible. You can actually get at your feelings by changing how you think, thinking more positively. I can do that. I can take this block out, or it's all just a game, right? Having a more positive or realistic thought, or also changing what you do and having more healthy behaviors. So we can help kids through CBT, and we want to do that in Turner syndrome. We're thinking we're going to make it a group therapy program because we heard about this feeling of non-belonging in our interviews. And so it might help teens with Turner syndrome feel less alone, give them a sense of community. We also know it needs to be family-based. We're going to need to have a parent and a child component because, as we heard, anxiety is a family affair, right? And we're also thinking it's going to need to be delivered over telehealth, just to make it accessible to people who don't live close to Turner syndrome clinics. And really fun news I was sharing with Mary Bell earlier, I just spoke with an program officer from the National Institutes of Health today about this project idea, and she was very excited and encouraged us to apply for funding. So we're very, very hopeful, and we'll keep people posted on that project too. So I just want to thank everyone. Thank you for sharing your experiences if you did participate, and thanks to our advisory board. Also, rare diseases are really underfunded severely. So we're really proud and we're really grateful of the funding we've gotten from the CCTSI, from the Ludeman Family Center for Women's Health Research. We're really grateful that they've invested in Turner syndrome. And then, of course, thank you to TS Colorado, TSTA, the InsighTS Registry, and Extraordinary Kids. Again, here's my contact information. So take a screenshot and know that you can email me, email me directly, or email our project if you want to be involved in any way.